Guest has said on this program that he is a fiscal conservative. All right, what does he think about paying for the health care plan? Let's ask Congressman Joe Sestak. He's a Democrat from Pennsylvania, former three-star admiral, if I'm not mistaken. Sir, there is widespread skepticism that you can take hundreds of billions out of medical costs to pay for even a fraction of health coverage. Do you agree with that?
No, I don't agree with that. I have to admit, though, some of the recommendations so far need work. Let's take Medicare Advantage. We know we're already paying, on average, for Medicare Advantage, about $1,100 more per every senior that opts into that Medicare Advantage program than we do if they stay in Medicare. Why are we doing that? So we know that's a real savings right there. And we know, and I agree with you, that Congressional Budget Office is not scoring it, but we know that staph infection cost us $130,000 for every staph infection. We know at Pittsburgh, the VA hospital there actually has almost zero staph infections because they mandate changing gowns. What a savings.
Congressman, I'm going to hold on for just 1 second. I have to point out to our viewers and to you, sir, that the Dow Jones Industrial Average is now down 108 points, largely because of that 3.99% yield, a higher yield on the 10-year Treasury. Congressman Sestak, let me get back to you for a second. If I may, I want to quote an email which we received on this program, which we asked for, from a doctor. And here's what he said. What about malpractice? I'm an orthopedic surgeon, and over half the imaging studies I perform are to avoid the 1 in a million case that I might miss without one, and then get sued. In other words, this doctor is practicing defensive medicine at a cost of tens of thousands of dollars. What does your plan say about tort reform and getting the lawyers off the backs of doctors?
Stuart, let me just give a couple facts of a study that has been done about 3 years ago. What it said is that the increase in health premiums, that has been about 100% in the last 8 years, only 3% of that was due to malpractice types of costs.
So that was malpractice awards, not defensive medicine, which could not be measured. And I'm putting it to you that defensive medicine is a much greater cost.
Yes, and so what we want to do on this, and you're right, we don't have enough in this first step into the health care reform on defensive medicines, but we do have a start, and that's the beginning of the economic stimulus bill. I think it's approximately $10 or $20 billion we put on for comparative research so that we can give out there, these are the standards that you have to have as far as in Texas or in Massachusetts, so that when people come back and say, I've got to be defensive, we said, no. The federal government has established in comparative research what the right types of treatments are. And that's why, Stuart, we've begun at least taking one step out there, but that was in the economic stimulus bill, and it is a part of the health care reform, but not enough. But that's the key of getting what's the right research show so we don't have defensive medicine.
Okay, we got it. Congressman Sestak, I'm terribly sorry to be out of time because we could talk